types of stitches. For example, this one is skin. Yeah, under the skin will be subcutaneous tissue, which is named fat. Yeah, fat. This one is skin. We want to finish our operation. I want to show you single simple type, after it horizontal type and vertical type, which are using, for example, for skin. How we should use our instruments. Instrument every time should be locked, because if it will be opened, we can lose our needle. Yeah, it should be locked. We should remember about safety. After it, most of students will use it like this. It's incorrect. We should make like this. By this finger, you will support for oneself. Okay. Simple single type. Skin, right side. Yeah. For example, here it will be fat. For example, we fix fat, and left side again skin. And I should finish, because it's single simple type. I should make ligation. How we can make ligation? This type can be used, or we can use another type. Now I will show second type. Look, egg, do, fix end and pull. I will not pull because it will be visible for you. Yeah, it should be visible. I will not pull hard. Egg, do, and close. Sometimes you can be confused in the beginning of surgery. You can fix here, not end of thread. You can fix, for example, this side. Oh, and what's happened? This trouble. Don't worry. Jugar is jugar. Oh, okay. This one is single simple type. For example, you finished it. You can cut it by kaichi, scissor. Scissor should be located like this. Angle should be in upper side, because if you will make it like this, you can cut any tissue. Yeah. Cut. Single simple type. Now I want to show you horizontal type, which is also using for skin. Look guys. Horizontal type. Skin. In inner side, for example, we fix fat, yeah, and again skin from left side. Okay. Now I should come back. How I should come back? I will come from left to right side. That's why it will be a reverse movement of our needle. Same distance from left side and same distance from right side. I came from right side like this and came back from left side. And what should I do? After it, I should make ligation. My favorite method of students, like this. I will not pull hard, okay? Because it should be visible. Look, why I said that it will be horizontal. I finished. And I will cut. Look, we can see that this one is incision and two horizontal lines. Yeah? That's why I said that it will be named horizontal. We can use for skin of patient both this one. But look, if we are saying about this simple type, when I will pull hard, skin will be closed. Yeah? Yes. For horizontal, skin will be little bit open. That's why it will be good for subcutaneous tissues drainage, for fat drainage. If patient is obese, if patients in group of risk for bleeding, or if it will be summertime, it will be hot. That's why high risk for any bleeding. Next type is vertical type. Right side, left side. And again, I should come back. How we should do it? Look guys, I will use same line, but it will be visible, yeah? Short, very short, about 2 mm from left side and about 2 mm from right side. Look. All understood here? First was skin, fat, skin. When I came back, just only skin to skin. Okay? I finished and I want to cut. And look, we said that it's vertical. Why? Previous horizontal lines, now we can see two vertical lines, yeah? It will be used for skin. Now I want to show you continuous type. Continuous type using mostly, for example, mostly using for muscles, for example. For muscles. On muscles, we can use continuous type. Look, I will start like this. For example, we are stitching muscles of patient. We should fix our thread, egg, dough. So, and I will continue. Now it will be very beautiful. Look, guys. Right, left side. Right, left side. We will not spend time to ligate and cut, to ligate and cut. We can use continuous, simple type, yeah?
Okay.
Так, a minute. Not surgical. We can use it for muscles. We can use it for, as your colleague said, for C-section, yeah?
Okay.
For myometum, for uterine wall. Visible, yeah? That it became very beautiful, no? Like girls' hairs, yeah, hairstyle. And look, I can show you modified continuous type. Look, previously I just simply pulled, but now look, guys, thread will be around the needle, and look which effect will be present. Hop. Second. Look, needle inside of thread. Hop. Modified type. No, I'm not pulling. Yeah, I'm not pulling hard, as you understood. In this situation, when I will stitch, my assistant should pull hard. But if you will pull hard this simple thread, it will be ruptured. Surgical thread will be ruptured in rare case. Visible, yeah, modification.
Yes.
Visible, yeah? For example, I want to finish. What should I do? Second end of thread is so far. We can again use surgical jugar. Jugar now. For example, I will take clamp and look. Egg, dough, and pull. Egg, dough, and pull.
Then cut.
Finish manipulation and cut. This one also should be cut in. Hop. Так. After it, I want to show you zigzag or Z type of stitches. Zigzag or Z type of stitches are widely using for vessels. For example, for ruptured vessels. You are making operation and on muscles would be any ruptured vessels. Small, large vessels don't matter. We can use zigzag type of stitches. Z type of stitches. If I will use pen, no problem.
No problem.
No problem.
No problem.
It is bleeding. What we should do? Fix muscle like this. Needle with thread will be needle with thread will be around the vessel. Egg.
So skin, muscle and fat all together.
For fat also. And again around vessel. From right to left side. Is it visible? Why I said Z type? Look, Z, yeah, or zigzag type?
Yes.
Z, visible, yeah. And look, when I will pull hard, it will be visible for you. What will be? Lumen of vessel will be closed. Look,
like multiplied.
Lumen of vessel is closed. Yeah?
Yes,
Is it
sir.
visible?
Yes.
Так, assistant, can you push? No. Take instrument. Yeah? Put it like this. No. Acha. Yes. Correctly. Ek. Do. Remove. Acha. Good result.
Yes,
Good
sir.
result. Zigzag type. And finally we can cut. Next type, intradermal, plastic type, for which in Pakistan will be taking a lot of money. I want to make stitching for skin, intradermal. That's why it will be just only inside of skin. I will be started here. Skin. Hop. That's why I use jugar, yeah? That's why I use jugar. Left side. Same level. Intradermal. एक दो
3 4
तीन
4
चार
5
पाँच
6 7
अच्छा. We will fix it and I will pull needle. We should remember about own safety. Huh? And так, where is Kaichi? I will cut. That's all. Patient will be with these two ends of, for example, thread. After 10 days, you can cut. Patient will come. You will fix it like this. And by Kaichi, scissor, no? You will cut this end and this end you can cut. That's all. But if you will have indication, patient will have indication to remove it, no problem. You can fix. Так. Not fixing. You can fix and you can remove. So,
ट्राई करने हैं
intradermal is
करने हैं नहीं वो तो बस 20 मिनट 40 मिनट ना लाते टांगे इतना